Since 2020, COVID-19 has affected all communities in our world. While many communities have already faced inequalities and disparities, COVID-19 worsened the disparities in low SES and BIPOC communities, leaving them to be increasingly vulnerable. Today, we will share with you the effects of COVID-19 in these specific communities and raise possible solutions.
Not only do low socioeconomic status individuals lack the necessary financial resources to obtain proper health care, they are faced with barriers as healthcare facilities are limited within their community's reach. The absence of these institutions prohibits these people from accessing preventative care and being able to communicate their health concerns. Individuals of low socioeconomic status are also unable to establish the time and funds to make traveling to vaccination and testing centers a reality. The time required to wait for medical attention and receive it by taking days off work is a luxury most low socioeconomic status cannot afford to risk.
In these communities, there is already a lack of transportation, which means it's harder for people to get to pharmacies, COVID testing centers, and vaccine appointments. Furthermore, public transportation is not even safe during COVID, as it can spread disease with people being so close to each other. In addition, to visit a doctor regarding COVID-19 issues, some people's only options were public transport. Access to internet is another problem, as 70% of students nationwide lack a computer at home and 18% lack internet access, according to a 2019 analysis by Associated Press. Without the internet, people cannot schedule vaccine appointments and find out where to get tested. In addition, it also prohibits students from being able to join online classes for school.
With COVID-19, many people had to deal with the digital anxieties brought on by how their jobs handled healthcare. In jobs that require physical presence and constant interaction, it becomes increasingly difficult for workers to protect themselves from contracting the virus, even if they have the resources to do so. Additionally, many jobs have poor benefits, and for those in low socioeconomic positions, this causes increased instability. If a job doesn't offer health benefits, such as paid time off for sick leave, they will lose hours or days worth of money that could have been invested in groceries or rent. As such, sickness becomes associated with loss of profit and subsequent loss of livelihood. Consequently, if someone becomes sick, they may not feel as if they have the option to take off, so disproportionately reliant on their daily income. The insecurity of health protections within careers is a component that is heavily realized by POC, who face the brunt of these ramifications within their lives.
Emphasizing the importance of inequalities means looking into healthcare affordability as well as accessibility. Establishing local healthcare facilities within the communities of lower socioeconomic status can be a great way to start mitigating the health disparities faced by POC communities.
Here are some other solutions and reform ideas that we have.